Our main topic is the digital health governance and leadership. Which direction? I have worked on this. So maybe just to start, I am Maganizo Monawe. I'm a senior digital health technical advisor in the Ministry of Health in Malawi. I worked on this with my colleagues. There is Dr. Andrew Likaka, Mr. Kenneth Kanyimbo, and Mrs. Rebecca Ntea. But I'll be presenting and also facilitating this session. We expect that this is an interactive session. There are some areas where we would expect our participants to also contribute and to share what you have in terms of digital health governance and leadership. We proposed to do this topic. I think that was in 2020. I think that time as a ministry, we were undergoing transformation in terms of digital health governance. So it made sense for us to share what we are going through and the considerations and steps that we are making in order to strengthen our governance and leadership for digital health in Malawi. At the same time, we also wanted to learn what other countries and are doing in terms of digital health. Since now it's 3 years down the line, I think we have gone through some of the transformation, and I'll be showing you what the status is. So I'll also bring in examples from other countries in terms of how they are managing digital health governance in those respective countries. So I think that's the background. So you can see, I think there's a lot that the session you can contribute in terms of the discussions for this session. I think to start off, just to give you the context in which the issues of digital health governance and leadership are key in our situation, and also I think this applies to other countries. I think in terms of challenges and barriers, the first one is low coverage for digital health interventions to support universal health coverage. I think as of now, many countries have made progress, including ourselves, but the challenge still remains to make sure that digital health is used to support health service delivery and to make sure that it supports universal health coverage. You know, the key issues in the universal health coverage are equity and access. So I think we are still low in terms of making sure that ICT is able to support this. So I think this is where leadership and governance is very important, to make sure that we use digital health to transform how we provide health services. The other issue is the inadequate harmonization of effort resulting in duplication. So I think this is a common problem in most of the low and the middle income countries because we have multiple initiatives. We have a lot of goodwill from different partners to make sure that they support digitalization But in doing so, the challenge has been verticalization and the individual approach to implementation of digital health. To make sure that we realize enough from all the investments. This is where leadership and governance is very important to make sure that we harmonize and we are efficient and we are investing in one vision for the ministries and the populations. The other issue, I think, which is also key when we are looking at leadership and governance and sustainability of digital health interventions. I think this is key, like in the LMICs. I'll give an example. You have a project which is running for 5 years and supporting a particular digital intervention. When that 5 years expires and the project closes, you'll find that another project pops up. And then instead of continuing the work that already started, you'll see that another digital intervention is being invested in and ignoring the one that was done in the last 5 years. So this is an issue in terms of sustainability. I think there are other issues around sustainability also, where leadership and governance is very important. The other one, I think, is inadequate and unskilled health workforce, where we also need significant or strong leadership and governance to make sure that we build capacity in the digital health to support service delivery. So I think looking at the leadership and governance, these are the 4 key areas that provides demand for us to have stronger leadership and governance in the different countries. So I think what we have here is the WHO building blocks for e-health. I think there are a number of blocks here. We are very familiar with this, but just to highlight that the leadership and governance is a key block in the building blocks that WHO and ITU provides. So what is leadership and what is governance? I think getting also from the e-health strategy development kit that WHO and the ITU provided. I think if you look in the description section, leadership and governance is an enabling environment for digital health to succeed or for digitalization to succeed. And it refers to directing and coordinating e-health at national level, ensuring alignment with health goals and political support, promoting awareness and engaging stakeholders. I think there are key roles here, which I will highlight later on. But I think this gives us a context for understanding what it means when we say leadership and governance for digital health. So I think looking at these building blocks, I wanted to get feedback from the audience. I think what we can do, you can just type your response in the chat section. But I think this is important to see, because people have been thinking the e-health strategy development kit was released a few years back. So I think since that time, people have been thinking in terms of those days we were talking of e-health, but now we are talking of digital health. So I think there are some additions that the people are thinking about, and some areas that we can use to extend the building blocks or to strengthen the explanation that we provide for the building blocks. So I think here we are talking of the 7 blocks: leadership and governance, strategy and investment, services and applications, standards and interoperability, infrastructure, legislation, policy and compliance. And then the last one is workforce. Now, this is a question to you. If you had to extend or if you had to strengthen these building blocks for e-health, now that we are in this period, we are talking of digital health. If you had to extend or to strengthen these building blocks with additional blocks based on emerging issues in digital health, which two of the following would you add? So this is for feedback. So there's artificial intelligence there. There's change management. There's data use, ecosystems. There's big data, and then there's space science. So I think just learning from you, based on your experience, which additional areas would you add for this? So maybe I'll just give maybe 1 or 2 minutes for the participants to share what you think in terms of this. You can write in the chat your feedback. Maybe we'll request 1 person or 2 to explain the responses that you may provide. Thank you. I hope everyone can hear me. Okay, so I think okay, so thanks very much for those suggestions. I think there's the I think there's feedback. We got data use and the change management. Yeah, and I think there's an agreement on those suggestions. May I ask if any participant could do maybe could say more on why data use and the change management could be the areas that we need to consider. I don't know, Lucy, if you want to say something, or Joe, if you can say something. Okay, but so thanks for the suggestions. I think these good suggestions, and looking at the other literature, they are in line with what people are thinking in terms of strengthening the WHO building blocks. So I think I'll just take you through one of those, which is in line with what you have suggested. So recently at the 2022 World Health Summit, I think Path and Cooper Smith, they launched a model which they are calling the dual model, data use and the acceleration learning model. So in this model, they are looking at the 7 blocks. I think they did a study while coming up with this model, and they talked to people and organizations. And in that study, 2 themes that came up were data use, ecosystems, and the change management. So it looks this is the direction in terms of trying to understand more or to extend on the building blocks. I think what we I'm showing there is the model itself, but I think just to show the positioning, if you read through the different sections of this model, you notice that most of the things are coming from the building blocks, the e-health building blocks. But inside green, you will see there's the data use ecosystem there. And then just after workforce going out, we have the change management. So just to show the significance of these 2 additional areas that we can think of. So why did I bring this up? When we are talking of digital health and the use responding to universal health coverage, we are talking of digital health transformation. We cannot achieve transformation without adequately managing change management. So just to show that this is at the center of consideration, and it means when we are talking about leadership and governance in digital health, we should also think about change management, because that's a component that can help us to transform our digital health ecosystem. Now, I'll take you through some of the models and the styles in terms of leadership and governance. This is where I'll take you through some examples on how we have addressed leadership and governance in Malawi, but also I will share with you examples from other countries in terms of leadership and governance styles. Now, I wanted to bring up this one because at the end, we need to see how much addition we can make in terms of what is there. So I think we are going to have a discussion at the end. And as I'm going through, I wanted you to be thinking through these questions so that we can have a fruitful discussion at the end. So the questions that maybe we can consider in the discussion, the first one, are there any other models that you have come across apart from the 3 presented? So I'm going to present 3 different models for leadership and governance. So I would like for the audience here to also if there are any other models to come out with to share those ones. The second question is, are there any improvements that we can make to any of the models? So as we present them, just to think through any other areas that we can make improvements so that maybe they can work better. The last one is about digital transformation. If we look at the models that I'm going to take you through, which one, if a country is or would like to undergo rapid digital transformation, which of the models would you recommend? So I think we can also talk about that one at the end. So I think just to make sure that I provide that context. Just a minute, sorry. Okay, so I'll come back to the building blocks, and this time I highlighted a number of key, because we need to still understand this issue about leadership and governance. So I just highlighted keywords from the building blocks. I think from management, functions of management, we have directing, which is highlighted there. Coordination is highlighted there. Alignment is highlighted there. And then, as we have seen, the issues of change. Change management is primary in leadership and governance if we have to undergo digital transformation. So this is from the ITU and the WHO e-health toolkit. So I will refer, I think, mostly in the rest of the discussion, I will refer to the Broadband Commission, a report that they commissioned, I think, through a consortium in 2017. I'll refer to that for some of the key sections, because it applies directly to what when we are looking at the leadership and governance. So according to the Broadband Commission, governance in the sphere of digital health is the means by which intergovernmental and cross-sectional collaboration is organized by entities that advise, coordinate, support, regulate, monitor, and implement digital health services and the applications. So I think this is very important: coordination, support, regulation, monitoring, and implementation. I think this is extending to the keywords that we got from the ITU toolkit, the WHO toolkit. So this is governance and leadership. So the Broadband Commission, in terms of the assessment that they did in a number of countries, they identified 3 models through which digital health can be governed for successful implementation in the different countries. Mostly, this is what through the analysis of how countries are approaching leadership and governance. These are the 3 models that they identified countries were implementing. So the first one is the health ministry mechanism. In this one, the MOH drives digital health and mobilizes technical capacity and skills from other ministries, agencies, firms, and organizations to deploy digital health systems. So for this one, it means the Ministry of Health has an arm within the ministry, which is responsible for the governance and leadership and implementation for digital health. We'll look at the advantages and the disadvantages of each of these one as we go through the different examples so that we can see their relevance. The other one is a government-wide digital health, digital agency mechanism. So in this one, in some countries, they have an arm at a national level, which is responsible for digitalization not only for health, but also for other areas of the economy. So this one, the MOH drives digital health, but is a client to a government-wide technology agency that provides significant ICT infrastructure and the capacity. In other countries, maybe they will call them digitalization agency, or they will call them, I think the common term is e-government. So that's what other countries would do to manage digital health. In other countries, there's which is the third model, is dedicated digital health agency mechanism. So the MOH leads health strategy, while a designated third-party agency or directorate drives digital health strategy and the solution implementation through its own technical capacity and resources. So for this one, it means you have Ministry of Health doing the service delivery, health service delivery, but also, and then you have an external body incorporated so that it can be responsible for digitalization. But this body is not in the ministry. Sometimes it can be, I think as we'll see some examples, it can be, but it operates as an autonomous. I think that's the key word. It operates as an autonomous body, whether it is embedded within the MOH or it is outside the MOH, but it operates as an autonomous body responsible for health digitalization. So I'll just give you examples, I mean advantages, challenges, and maybe examples of where each of these models can be available. And then I'll be giving you examples of how this has been implemented. Excuse me. So in terms of advantages, I think for this one, the health ministry mechanism, I think that's the one we are starting with. In terms of advantages, the MOH has a comprehensive view of national health priorities and can ensure close alignment of the digital health strategy with the national health strategy. So I think that's the main advantage. If you are one, digitalization is within, governed within the MOH, responding to the health priorities can be easier because you're operating as one team. So I think that is advantage. However, there are challenges. If the digitalization is within the MOH, chances are you need to collaborate. There's need to collaborate with other governmental agencies, and that can be difficult because as the MOH, a body within MOH, you have to navigate through how to bring on board other ministries, like ministries of ICT. When you talk of determinants for health, there are other ministries that you need on board. So I think that that's one of the key challenges. The other one, as a Ministry of Health, and you have your own digitalization governance structure, for you to build and sustain technical capacity, it can be a challenge because you are just one body, and the career mechanism for ICT, you really need to manage that. And the other one is the surviving changes in leadership. You are very vulnerable to changes in political leadership. So the structure can be fluid because it can be rearranged based on changes in political. But a number of countries, I think this one is very common, the health ministry mechanism. You can see the list of countries there: Brazil, Chile, Ghana, Kenya, Malawi, Philippines, Rwanda, and South Africa. It's possible that some of the countries mentioned here, maybe they have realigned, they have changed their model. This information is as of 2017. So I'll just give you an example of how we are doing governance and leadership in Malawi. So this is the first example. When you go back to the definition for governance that ITU provides, there's the issue of coordination there. I think that one is featuring highly. Even in the definition by the Broadband Commission, issue of coordination is featuring highly. And the coordination is within the Ministry of Health and also coordination with other stakeholders outside of the Ministry of Health. So for us in Malawi, to make sure that we support with this coordination, this is the structure that we are working with, which we proposed and we have approved from the implementation of our digital health strategy. So as you can see at the top there, we have the Secretary for Health and Population. This one is the Principal Secretary. And within that, you can see the number of bodies. If you go to through the left, you see the Digital Health Steering Committee. And then below that, we have the Digital Health division. Yeah, we have the Digital Health division. But the Digital Health division, you can see that it is being advised by the steering committee on one hand, and then the digital health sector wide technical working group as also on the other hand. So both the steering committee and the sector wide TWG, the reason we proposed this tool, the steering committee is a decision-making structure in terms of policy, guiding policy, whilst and it comprises the Ministry of Health and other ministries, and it is chaired by the Secretary for Health, who is the Principal Secretary. And then the Health Sector TWG, this one is meant to bring all the partners, including the Ministry of Health, together in the decision-making and implementation for digital health. So this one is mainly a consultation and a forum that provides multiple stakeholders an interface to contribute to digital health implementation, leadership, and governance. At the same time, within the ministry, because we said this is a ministry mechanism, within the ministry, you can see that at the top there, there's the Ministry of Health Leadership, and it is headed by the SH, Secretary for Health, who is the Principal Secretary, and then the senior management team. These are directors from the different departments in the ministry. So within that, we have the Directorate, our Department of Planning and the Policy Development, and within that directorate, we have the Digital Health Division. Yeah, so we have the Digital Health Division. And you can see within the Digital Health Division, there are different sections. There's standards and policy, compliance, analytics and decision-making, user capacity and support, product development, and the sustainability. So we have all these sections within the Digital Health Division. So this provides now as the inside ministry governance mechanism. As I said, other countries are also following a similar approach. I think one of them is Philippines. And what you can see there is almost a similar structure. And then I can draw your attention right down there, where also there are different functions for the in-ministry mechanism. I think here there's governance. So I think in the governance, legislation, policy, and compliance, standards and interoperability, and for that. So this is an example on the ministry mechanism. The second one is the government-wide digital agency mechanism. I think there are a number of advantages. A common digital, so the advantages for the government-wide mechanism is that you can have a common digital architecture that different ministries can use to develop their strategies. The presence of separately funded one-stop shop for ICT expertise and the resources, and the established processes for interaction and communication between ministries and digital agencies. So basically, if you look at these advantages, they are actually addressing the disadvantages that you might get with the ministry mechanism. But however, it also has challenges. I think centralization is also a big issue. Things move slowly in decentralization sometimes. A lot of protocol and bureaucracy. Requires more effort for alignment and coordination between MOH and ICT agency. High initial investment, because you need to have all the staff. You need to have equipment for this to function. So examples, you could be looking at Estonia, Malaysia, and Singapore, where this has been functional. So in terms of government-wide mechanism, I'll also take you back to Malawi, where we have a ministry responsible for information and digitalization. So it means when you look at this, it means in Malawi, we are following a combined model. We have a government-wide mechanism where there's a ministry responsible for information and digitalization. And then we have a ministry mechanism where we have a digital health division that is the coordinating and the responsible for digital health implementation. So it's advantageous for us to have Ministry of Information and Digitalization because they are responsible for ICT implementation policy. And they handle issues that we cannot handle as Ministry of Health. For example, now they are handling the Data Protection Act, which will be useful for all the sectors in the government. They did the E-Transactions and Cybersecurity Act, which is also for all the sectors. They also facilitated the Access to Information Act, which is also for all the sectors. So this model gives us an opportunity as Ministry of Health to draw from what Ministry of ICT is leading in terms of digitalization, but also it gives us to focus only on the digital health issues. So I think this is a combined model that we have. But also just to mention that we have the regulatory authority. It is under the Ministry of Information and Digitalization, but it is an autonomous body. So also it's very vital for our governance and leadership. So that is for Malawi, but the government-wide mechanism is also well implemented in Malaysia. You can see a structure there, which is coming from the Prime Minister's office. And then there's the National IT Council. And then you can see there are different agencies, but responsible for government-wide digitalization processes. The last one is the last model is the dedicated digital health governance mechanism. So this one also provides an opportunity to have a common architecture that can serve as a common reference and a blueprint for digital health implementation. It can also, I think, the key advantage of this, because it is a dedicated mechanism, autonomous, either within the ministry or outside. So the key advantage here, I think, is the issue number 2 there, continuity through changes in government leadership, and also can build capacity and technical knowledge. So you can see that the advantages here are trying to address the disadvantages in the government-wide and also in the ministry mechanism. But this one has a problem. I think the key problem, you can see it's an autonomous body, either within the ministry or outside. The very fact that it is an autonomous body, it means it is working independently. It has an outsider status, which makes it difficult for it to integrate MOH priorities. And also for digital transformation, for you to facilitate change, it's very difficult from an outsider status. So I think that's a common issue there. So I think we have gone through the different models. As I said at the beginning, I think we have given some examples on how other countries, including Malawi, are implementing digital health leadership and governance. But we wanted to hear, I think for the next maybe 10 minutes or so, to get maybe some feedback in terms of experiences from the participation that is here. I think the first question that we are going to look at is, are there any other models that you have come across apart from the three that have been presented? If there are experiences on any other models, we would like to learn from that. So let me open the floor and get any contributions that we might have. Thank you. So whilst we are waiting for hands to anyone to come in, we have our former director for digital health and quality management, also co-author for this session, Dr. Andrew Likaka. Maybe you have some additions I can give you to add whilst we are waiting for contributions from the audience. Thank you.
All right. No, thanks very much, Maganizo, for taking over. I think this is very, very rich information and addressing really the whole essence of the discussion. And colleagues, yeah, I think it's the governance and leadership for digital health, a right direction, a right setting will obviously give us better results. I think one area that another areas we are thinking also of models, something also that we need to be thinking about, probably some of the governing terms like digitalization, essentially, what is it that when we are coming to the health sector, what is it that we are looking at? Is it digitalization? Or are we really looking at the processes of care? And I'm glad also the issue of data use is very, very pivotal. Our governance structures, how best are they making sure that they cover those three aspects? There is an issue of change management. At the moment where I am now, supporting Malawi blood transfusion, I'm struggling with this issue of change management for people to adapt digital tools. So there is a parallel paper system as well as a digital system. People would rather use the paper-based system, get data teams to enter that information into the digital system and work. And this is common in even most of the hospitals. So the other issue, I think, is to do with implementation governance. We have to acknowledge that technology is in a transition, has found some of us already old, and there is a younger generation that is technology competent, that is moving well with technology. Bridging the barrier between the old people who are already managing services, but they don't know how to use some of the basic computer skills, versus the younger ones that are very competent in that aspect. I think that's another area to think about when we are looking at the governance structures, so that implementation works better. Finally, I think my contribution goes to when we are looking at the digital health, it's an issue of regulation beyond just the software. We are looking at the patient care in that aspect. We are looking at patient outcomes and improving quality of care. So patients are coming to hospitals to get treated and not to line up to a computer or to line up to get counted for data. I think all of us who are at the audience here will agree with me that when you are sick, what you want to see is you get treatment. So governance has to be aligned to patients' expectation for care, so that it doesn't annoy patients that they are queuing just to be counted or to get their information into the system, but the waiting time still becomes a big issue. Otherwise, I just wanted to bring in those sort of thought-provoking issues for us to be really moving forward. Thank you very much, Magan.
Okay, thanks very much, Dr. Andrew Likaka. So maybe what I'll do, I'll go, it means, I think on the first question, I think we are good on that in terms of any other additional models. So maybe having looked at these three models, are there any improvements that we can make to any of the models? So maybe also just looking to hear from the participation, any suggestions on any improvements that can be done to the three modules. Remember, the three modules are Ministry of Health mechanism, government-wide mechanism, and then the last one is dedicated digital health mechanism. So are there any improvements that we can make, or any contributions that anyone can have on these three models? So I open the floor once again. Yes, Moses, please proceed.
Okay, yeah, thank you for the presentation. I'll just share my comments on the improvements. I really don't think that standing from where I am, one can give a solid answer to it. Basically, for different governments or different countries, I think that it will be different. But what I would like probably maybe to suggest, I like the view where it comes from a government drive, a government-wide drive. The key there is, I believe that when you come from that angle, you need to make sure that the Ministry of ICT or that of communication is very strong, because if you are going to burden the department or the Ministry of Health with technical IT stuff, I think that becomes just brings a big overhead. The idea of the Ministry of Health is to provide care, healthcare to the population. So you would want to take things that are supporting that vision or that mission, keep them to be support services. And it's always nicer if you have the other departments or the other ministries strong in what they do, because then you leverage on what they know and what they do. You know, give work to the specialists, you will get the best out of it. But if you do it as a buy thing, you know, you're never going to get the good results. They normally say that you cannot produce anything that's groundbreaking if you do it as a byproduct. You need to really go deep into it. On the other end, if you find that the countries do not have a very strong Ministry of ICT, then really it becomes a burden to the Ministry of Health to do the technical IT stuff. I would recommend, if you have got that case, your Ministry of IT is not so strong, then you as a Ministry of Health needs to take the initiative. I think that there's a number of technology partners that are out there in the world. So those would be the things that you can use to make sure that your digital health systems are running and running well. It does come at a cost, of course, but I think it all depends on the level of maturity of your ICT ministry or that of your communications. If you can leverage on that, I believe that you can use any of the models, but I really like the one where it comes from the at the government level. I like to always bring a case that is, I think it's breathtaking to see what they've done. If you look at Estonia and the way that they have changed their ICT infrastructure, and you know, it really shows that if you strengthen the IT infrastructure, you can build anything on top of it. You can provide most of the government services in ways that we have never even thought possible before. But it really relies on providing that enabling environment. And without that, it becomes difficult. I really, if it was according to me, wouldn't like to burden the Ministry of Health with ICT issues. Maybe I would like to end there and hear what other colleagues would want to say. Thank you.
Thanks, Moses. I think that's very rich contribution. Essentially, let's burden less. I think the advice is as less burden to the Ministries of Health, the better, so that the other the ministries can focus on service delivery. I think, I don't know, Lucy, whether you wanted to say something. There's also, but you put down your hand. There's also a hand from Brian. So Brian, please go ahead.
Thank you, Manganizo. I think I want to share an experience that we have around this in Uganda. I'm based in Kampala. I work with MEDIC and we currently support the National Community Health Information System. I think the direction the conversation is going is interesting. So we have a Ministry of ICT, and it has a semi-autonomous body called the National IT Authority that is mandated with running government technology, delivery, services, and the like. And then we have the Ministry of Health. Now, within the Ministry of Health, we also have ICT department or ICT unit, which runs most of the ops within the Ministry of Health, including maintaining servers. And then we have, of course, the user department. So the departments that are interested in the digitization work that partners are supporting. And in between those two, we have what we call the Division for Health Information, which, if you like, is sort of the body or the team that is more responsible for technology digitization projects within the ministry. And that is part of it's part of the technical working group that's responsible for health innovation, information, and research. And so as we discuss governance, I was just sort of thinking through how whether that's actually a good separation of roles, or whether it's an interesting mix of many cooks in the kitchen, and to what extent that can be either good for coordination, for work, for multi-sectoral support, or indeed challenging for the very same reasons. How do you bring everyone on the table when you need to make important decisions or lasting decisions, if you end up with so many centers of power and centers of coordination for this work? Thank you.
Thank you very much, Brian. So I think you have raised key questions that we need to be thinking about, especially the issue of so many centers of power in decision making and governance. I think that's key, because then it affects the direction that implementation can go. So thanks for that contribution. So I think we are at exactly 10:20. Our session was supposed to finish at 10:20. So it means now we can wrap up. Let me thank everyone for participating, and also for the contributions, very rich contributions on the issues of leadership and governance for digital health. Thank you very much. I appreciate. Thank you. So it means the session has ended. Thank you.